So good afternoon. Everyone can hear me okay? I'm leaning in well enough. So I'm Mike Reinhardt. I'm a geriatric psychiatrist. And I now run our Center of Excellence for Alzheimer's Disease at SUNY Downstate. It's a pleasure to see you all. And it's a pleasure to talk about our center. And I owe also a big thanks to Dr. Libyan for introducing Alzheimer's disease so clearly. So I'll be more brief. We know that Alzheimer's disease is affecting our country and our communities at an astronomical rate. There are over 410,000 people here in New York State already suffering from Alzheimer's disease, not including even others that are suffering from related dementias. And the burden on caregivers and other individuals is astronomical, both economic stress, personal loss of productivity, etc. So some of you may know that we've had an Alzheimer's disease center at Downstate dating back into the 1980s, run by my mentor, Carl Cohen, and also by Howard Crystal, one of our close collaborators and prominent researcher. And more recently, coming back to 2015, the New York State Department of Health, in recognition of the tremendous burden that already existed for Alzheimer's disease in our state and the likely increase in burden over the coming decades, created the Center of Excellence for Alzheimer's Disease award stream, an award stream that is dedicated to improving care for both patients and caregivers across the state and improving care outcomes. And so my talk will be a little bit more light than the other talks today. I'm going to talk about the service delivery, the focus of the first 5 years of our CAD award, as it's called for short, and how we're restructuring, and how I would like to call all of you to collaborate with us. We've built an extensive network of both community partners, clinical partners, and have a very busy service which is ripe for research. We want to work with you, all of you. So we are one of 10 centers in New York State. We're one of 3 in New York City, the other 2 being at NYU and Columbia. These centers span leadership across geriatric psychiatry, like me, to behavioral neurology and geriatric medicine, and one center is even led by an administrative group. Here in New York City, we've built a fairly strong relationship across the centers, both for clinical collaboration and now, as we're moving into our new award cycle, which starts this June, for extensive clinical trial collaboration. We're developing a network of centers that will self-refer to each other across available clinical trials, serving as sites for each other. Our previous focus on the last 5 years of funding was predominantly on diagnostics, treatment, and education of community members and patients. So we weren't a predominantly research-focused enterprise. That's changing in this new award cycle. Our focus is now moving to research in addition to diagnostics, treatment, and education, because we all recognize that this disease cannot be handled through just our currently available treatments. We don't have disease-modifying treatments. It's been very disappointing across the clinical trial and research enterprises thus far in the treatment paradigm, recognizing all the excellent basic science and translational research that was done here today, talked about here today. So our service is busy. We have a main center, we have a satellite center at the Coney Island Hospital. We see up to 20 new patients per week in our center, not counting follow-up cases, and have a comprehensive care team that spans geriatric medicine, geriatric psychiatry, consultative relationships with behavioral neurology and our Department of Neurology, research support specialists, and a really diverse staff that can handle all of our patients. We conduct 2 to 3 hour comprehensive evaluations spanning patient and caregiver histories, physical and neurologic exams, and neuropsychological testing batteries and behavioral scales, inclusive of neuroimaging and volumetric scans we send out for neuroquant analysis of all of our early onset patients and early stage patients, in addition to all of the other standardized testing that is done for patients when establishing a clear diagnosis. And so just to give you a sense of our most recent year's productivity and diagnostic span, we saw over 600 patients in our service for diagnostic evaluations. The predominant diagnoses were Alzheimer's disease and a major neurocognitive disorder due to multiple etiologies. We have a lot of mixed pathology in our communities, right? There's a lot of multi-complexity. And over the past year, as we've done a lot more and more education, there's been a skew to patients presenting earlier, evidencing that our outreach education has really made a dent in the community. We're having patients come in with mild neurocognitive disorder at increasing rates. And these patients deserve study. They deserve our attention, and we would like to work with you all. Our outreach education has been extremely productive, reaching, just in this last year, almost 1,200 individuals. And as we move into this new funding cycle, we don't want to only serve our already underserved population. We want to make sure that we're serving all of New York City's underserved populations. We're in the process of developing enhanced partnerships with federally qualified health centers here in Brooklyn, the Brownsville Multi-Service Family Health Center, and additional federally qualified health centers in Queens, the Bronx, Staten Island, and my other circle got shifted somehow, in Chinatown, in Manhattan. So we have a diverse population that represents many of the catchment areas that we would all be interested in when studying Alzheimer's disease, particularly in populations that have been historically undersampled. Many of the National Alzheimer's Coordinating Council sample is predominantly Caucasian. And I think we're in a unique position here in Brooklyn to change that, to make sure that we have a comprehensive and diverse sample that is well categorized across biomarkers, neuropsychological markers, neuropsychiatric markers, and longitudinal trajectories. In addition to our clinical productivity, our educational productivity is also quite high for those of you that are interested in educational scholarship. Our center serves as a, I think, somewhat unique home of interprofessional education at SUNY Downstate. We have trainees from all of the colleges and schools rotating in our center in interprofessional teams caring for older adults with Alzheimer's disease and related dementias, and learning the objective measurement of these conditions, the appropriate objective diagnostic testing, and how to work together collaboratively to deliver the most effective and evidence-based care. Okay. So I'll close by saying that as I am working to reorganize this center, I'm going to be reaching out to you. I want to work with all of the different departments at SUNY Downstate to build up our center and make it, hopefully in the future, a home for a center of excellence for aging health, in addition to being a center of excellence for Alzheimer's disease. I think we're uniquely positioned for this. We have a large patient cohort that is exceptionally diverse. It is built, our center is built in a modular capacity with research support already in place. I can add protocols to our center's diagnostic algorithm, objective measures, biomarkers. We can do whatever we would like to better categorize our population, and I would like to work with you. Our network of community partners is also ripe for community-based participatory research. For those of you in interest in cultural inputs into Alzheimer's disease and related dementia, community-based interventions. And I'm looking forward to working with you all. There will be a second part of this talk. I focus mainly on the structure of our center, how we operate, what we have done so far. My mentor, Carl Cohen, has a recorded talk that will play next, which will talk about a little bit of the research that has been done in our center over these last 5 years. Thank you very much.